Dr. Ashish Jha is a professor of global health at Harvard School of Public Health, and he joins us now. Dr. Jha, good morning to you. You see what's happening in Florida. How do you explain it? What do you make of this record daily surge of cases there?
Yeah, so good morning, and thank you for having me on. The situation in Florida is pretty worrisome. There were more cases yesterday in Florida than in all of Europe yesterday, and this is obviously a situation that's getting worse. I think we know how we got here, right? Florida, along with other states, opened up too early when they weren't quite ready. They didn't meet the White House's own guidelines. And they opened up too aggressively. They had bars and restaurants and other things open when they weren't ready to do it. And then I think the biggest problem recently is they've been too slow to react. Still don't have a statewide mandate for masks. There are a lot of other things that I think they still should be doing. And I don't think Florida has been as aggressive as it needs to be.
What about those who say, look, it's a function of more testing? There has been a surge in testing in Florida as well. And the governor there points out that many of these cases are actually among young people. Does that mitigate it at all in your mind, make it any less worrisome?
Well, look, there has been a surge in testing, but what we've seen in Florida is a big increase in hospitalizations. That can't be explained by testing. And now we're seeing a big increase in deaths. And obviously that can't be explained by testing. So the fact that it is among a slightly younger population is helpful, but we are still seeing many of them get sick and many of them die. And then more recently, we've started just in the last couple of days seeing data that, at least in Texas and in other places, older people are starting to get infected again, partly because young people and old people mingle. They live with each other. And so the idea that it could stay just among young people is probably unrealistic.
We've seen, obviously, surges in Arizona and Texas, Florida. We've discussed at length. You also see it in California, where the perception was that they reopened at a more measured pace. How do you explain that California, too, is seeing this increase in cases?
Yeah, so California is a state that did lock down early, had a very aggressive policy. When they relaxed their regulations, they really left it up to local counties. I think a lot of states did that. And a lot of counties, especially in Southern California, I think, again, made a lot of the same mistakes, pulled back too early. And then I think the state was slow to react to it. So when I look at parts of Southern California, it looks the same as Arizona and Texas, in real trouble. And I'm hoping in the days and weeks ahead, we're going to see a very aggressive response from the government, from the governor of California.
I do want to talk about the issue of schools, which we just covered. The Education Secretary Betsy DeVos said on a show yesterday, there's nothing in the data that suggests that kids being in school is in any way dangerous. What do you think of that? Do you agree?
I think that's a little more cavalier than I would be willing to be. There's no question in my mind that kids are less likely to get sick. And there's pretty good evidence that they're less likely to spread the disease in adults. But that's really not the question. The question is, in a hot spot like Arizona or Texas or Florida or, probably about a dozen states, if you open up and have large numbers of people, kids and adults, in buildings inside all day, can you do that safely? And I think most experts would say not really, not if you're in a hot spot. So in places where things are really bad, I think it's going to be very hard to open schools and keep them open.
All right, Dr. Jha, always good to talk to you. Thanks for your time this morning. Appreciate it.
Thank you.